So the organizations that have been created are known as medical service organizations or management services organizations for medical practices. And the purpose of the organization is to take care of the non-patient care related administrative responsibilities of the practice, which have become quite complicated over the past decade or so. What they do is these management services organizations come in and they'll handle the billing practices, they'll handle leasing space, purchasing supplies, and even some of them become involved in the personnel decisions such as hiring and firing. There's a couple of issues that are raised by these arrangements. One of the issues that's raised by these arrangements is that the management services organization must not become involved or must not direct and control patient care activities. So they cannot direct a doctor or a nurse practitioner or a physician assistant how to provide patient care or what's appropriate patient care. One of the things that are often outlined in these agreements is how the patient care is to be provided. Who is to provide it? Will it be provided by a medical doctor or a physician assistant or a nurse practitioner? And if it's to utilize a physician assistant, most states have significant regulations about the supervisory responsibilities of the practice for the activities of those individuals. So all of that would have to be set out in the agreement. Who's responsible for supervising these individuals and making sure that an appropriate standard of care is met on the medical side of the practice. A second area that is a problem is that the compensation of the medical services organizations must be fairly fixed in that contract and not be based upon revenue production by the practice. So it should not be a percentage arrangement based on the revenue production of the practice, because that could fly in the face of anti-kickback provisions of the federal statutes. And what they've done is create safe harbor provisions, because the federal government is not against the utilization of medical service organizations, but they did want to provide guidance on how these relationships have to be constructed and managed between the parties. The safe harbor provisions are fairly specific, and I think there's probably 6 steps that must be adhered to and should really be set forth in the contract and then adhered to as the relationship goes forward so that you don't violate any of the federal or state regulations or laws. The reason to set up a good agreement and to make sure the practice complies with the agreement is because the penalties can be severe. There's both fines and other penalties that can be applied to the practice, as well as you can be prevented from participating in the Medicare Medicaid program for years going forward. And once that happens, independent insurers can decide to drop your participation as well once the Medicare or Medicaid programs decide to drop your participation. Overall, medical service organizations provide a very important function in the practice of medicine, but they must be done compliant with the safe harbor provisions and with the federal and state laws.